Welcome to the module Managing Candida auris in a Care Setting, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for licensed staff working in multiple healthcare settings who care for a variety of patients. The purpose of this course is to further your learning and build on your current knowledge about Candida auris, often referred to as C. auris. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Managing Candida auris in a Care Setting, is part of a series of modules exploring Candida auris. You are viewing the third module of the series, which provides a general overview about steps to take if Candida auris is identified in your setting. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. After listening to this module, you will be able to describe the steps to take if Candida auris is identified in your healthcare setting. As shared in Module 2 of this series, it is important to follow infection prevention guidelines with all patients and residents, since those that may be colonized with C. auris and not showing any symptoms are able to spread the organism to others. If C. auris is identified in your healthcare setting, there are some additional measures that must be taken to prevent the spread. These include reporting to the Public Health Department, following appropriate precautions and ensuring personal protective equipment is used properly, ensuring patient care environment is cleaned with appropriate disinfectant, screening, and clearly communicating a patient or resident's MDRO status when an individual is transferred to or receives care at another healthcare facility. Candida auris is a reportable disease. If a case of C. auris is identified in your healthcare setting, you must report it to your health department. The links on this slide will take you to information regarding C. auris reporting in Minnesota, Michigan, and Wisconsin. To prevent the spread of a confirmed case of C. auris, ensure adherence to the CDC recommendations for C. auris infection control. Use either contact precautions or enhanced barrier precautions to manage residents with C. auris in nursing homes, depending on the situation and local or state jurisdiction recommendations. Refer to the CDC guidance on enhanced barrier precautions included in the reference slide at the end of this module for more details about when contact precautions versus enhanced barrier precautions would apply. It is also recommended that patients infected or colonized with C. auris reside in a private room if possible. Patients in healthcare facilities often remain colonized with C. auris for many months, perhaps indefinitely, even after an acute infection has been treated and resolved. The CDC recommends continuing contact precautions or enhanced barrier precautions, depending on the healthcare setting, for the entire duration of all inpatient healthcare stays, including those in long-term healthcare facilities. The CDC also recommends adherence to hand hygiene and the use of gown and gloves when in contact with patients or residents with C. auris. To remove barriers to the use of PPE, Make sure that gowns and gloves are easily accessible. Provide training on the use of PPE and hand hygiene, and ensure that staff are using PPE and washing their hands properly. C. auris can persist on surfaces in the healthcare environments. C. auris has been cultured from multiple locations in patient rooms, including both high-touch surfaces, such as bedside tables and bed rails, and surfaces farther away from the patient, such as windowsills. C. auris has also been identified on mobile or reusable equipment that is shared between patients, such as glucometers, temperature probes, blood pressure cuffs, ultrasound machines, nursing carts, and crash carts. Perform thorough routine, at least daily, and terminal cleaning and disinfection of patients' rooms and other areas where patients receive care, such as radiology and physical therapy, using an appropriate disinfectant. Clean and disinfect shared or reusable equipment like ventilators and physical therapy equipment after each use. Label cleaned and disinfected equipment as such and store away from dirty equipment. A list of antimicrobial products that are registered with EPA for claims against Candida auris is included in the references at the end of this module. You should consult your public health department for recommendations on which patients or residents in your healthcare setting should be screened for C. auris. Health departments and healthcare facilities will consider several factors when deciding which patients to screen who have had contact with a patient with C. auris infection or colonization. This is referred to as the index patient. At a minimum, they may recommend screening roommates at healthcare facilities, including nursing homes, where the index patient resided in the previous month. They may also recommend screening patients who require higher levels of care, such as those receiving mechanical ventilation and who overlap on the unit with the index patient for 3 or more days, as these patients are also at substantial risk for colonization. It is also good practice to screen hospital patients on admission if they are at risk of C. auris exposure. The Minnesota Department of Health recommends that upon admissions, patients are screened for C. auris if they have had an overnight stay in a healthcare facility outside the United States or Canada in the past 12 months, ambulatory surgery or hemodialysis outside of the United States or Canada in the past 12 months, and/or have been inpatients or resided in a skilled nursing facility stay in the previous 12 months in areas with documented transmission according to tracking data from the Centers of Disease Control and Prevention. The CDC does not recommend routine reassessments for C. auris colonization. Long-term follow-up of colonized patients in healthcare facilities, especially those patients who continue to require complex medical care, such as ventilator support, suggests colonization persists for a prolonged period of time. Surveillance has identified patients that remained colonized for longer than 2 years. When a patient or resident is screened for Candida auris, you may find that the person is colonized with the organism. With colonization, organisms inhabit a specific body site, such as the skin, the urinary tract, or the respiratory tract, without signs or symptoms of infection. Candida can be a colonizer in urinary specimens, respiratory specimens, external ear, skin, and wounds. If the person is colonized and does not show signs of illness, antifungal therapy is not required. Persons that have Candida auris infections, on the other hand, have signs of illness or inflammation due to tissue damage caused by invasion of the organism. Invasive candidiasis can include bloodstream infections, endocarditis, intra-abdominal ocular soft tissue, urinary, and/or osteoarticular infections. Infection requires antifungal therapy. For Candida auris, both colonization and infection require the same infection control measures. If a patient or resident has symptoms that indicate Candida auris infection, consult an infectious disease specialist. This organism appears to develop resistance quickly. Even after treatment for invasive infections, patients generally remain colonized with C. auris for long periods and perhaps indefinitely. Patients on antifungal treatment should be carefully monitored for clinical improvement. Finally, to prevent the spread of C. auris in your community, when a patient or resident is being transferred from your facility to another healthcare setting, be sure to clearly communicate the patient's C. auris status to the receiving healthcare providers. This includes communicating any pending cultures to the receiving facility. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Managing Candida auris in a Care Setting quiz on the Frontline Forces webpage or in the YouTube description below. For further information, refer to the references on these slides.